the finest clinical design of any. That is a crossover feature. At midpoint, those that were getting the active medication got switched over to give the placebo and vice versa. And they never knew. And then we could check the results. And we could make these people appear normal. We got 75% average symptom relief, which then outperformed all standard of care treatments and still does to this day. Let's take a look at endocrinology now and what it means as we circle back into medicine and try to keep everything working so that we can build on the tremendous, mighty shoulders of the scientists and physicians that have gone on before you. We cannot just work as an individual out there without that tremendous knowledge base. Let me give you the knowledge base. Here are the 4 factors that incite inflammation: stress, infection, allergy, and injury. So this is standard thinking. When I say standard thinking, I hope that you understand we professors are an odd lot, and there's some of us someplace all the time objecting to standard practice and challenging it. That's fine. Good, go for it. But this is commonly accepted. Now, inflammation and the immune response are intimately associated, as we pointed out. With inflammation comes the immune cells. Now, if you study that, this would be a natural consequences. The immune cells quenches infection. So then one of the 4 instigators of the inflammation is taken care of by this, so the next step would be acceptable. That is, now the infection has been cured with time. Now, if there's nothing that stops the inflammation as occurs with people with rheumatoid arthritis, then the following thing happens. Now we get into a bit of speculation. But the leaky blood vessels that remain in the areas of the hurt continue to let immune cells out without ceasing. That would mean there would be a net accumulation of it. Yes, there's some immune cells that escape, let's say a joint. But cells get old, the cell walls break, and they fall down and deposit around the edge. So the evidence of an autoimmune disease is there. It's firm, it's solid. There is a lot of too many immune cells around to be healthy. There's dead ones, live ones. These cells then are like soldiers with nothing to fight. Now what do they do? What do old soldiers do? Cell walls break. Once the powerful lytic enzymes of the immune cell are released, then they're no longer constrained by the immune cell to attack their targets. These cells then, these enzymes then attack the chemical bonds they're designed to attack, whether they're part of the body or part of the invader. Any time that the immune cell wants to turn around and attack the host, it can kill the host. The host is at the mercy of the immune system. So if it were rampant throughout the whole body, I don't think the body would survive that attack. Rather than, again in my laboratory at home, the destruction occurs where the inflammation is. Thank you. So the destruction is specific within an autoimmune disease. Where there's pain, where there's inflammation, there's destruction, no doubt about it. Where there isn't pain, there is no destruction. So the immune system is specific to that area where the inflammation is, where there's leaky blood vessels and the immune cells keep coming out. And so we probably need to qualify that statement. Autoimmune diseases is a disease where the host is being attacked. It is, but only in certain areas, and probably because of the reason I cited earlier. All right, so let's now move on. But that is one place where we're moving on a bit outside of existing knowledge. We're all in agreement that the immune cells are attacking the host, hence the autoimmune diseases. It's just the question is why. Now let's move into another part that is known. When inflammation comes, it signals the hypothalamus within the brain that it's there. When the hypothalamus knows, it signals its neighboring gland, the anterior pituitary, that the inflammation is there. When the anterior pituitary knows that the inflammation is there, then it tells the adrenal cortex, where the cortisol is made, that the inflammation is there. Now that's called the hypophyseal axis by some people. Other people will call it the hypothalamic, something else. Pituitary adrenal, oh, thank you, axis. And so whatever it is, this is accepted knowledge, and I think there's adequate evidence that that's all okay. If you look a little bit further, then you can find folks coming up and saying that when the hypophyseal axis is stimulated by inflammation, there is a cortisol pulse that comes. That's more hidden. That's not usually taught as part of the hypophyseal axis, but you can generate enough data saying that this is a good picture. We can say this is standard medical knowledge with the two qualifications that I made. All right, now if that's the case, then we're missing one arrow, one very important arrow. What is the purpose of the cortisone pulse or cortisol pulse? If it isn't to stop the leaky blood vessels, if it doesn't stop the leaky blood vessels, then the inflammation goes on. When it does stop the leaky vessels, the pain goes away, the swelling goes down. If it stops the leaky blood vessels, it stops the immune response. If it stops the immune response, there aren't extra soldiers hanging around, getting drunk and doing damage to the host. So we stop the autoimmune disease, we stop the inflammatory disease by that one arrow. We convert the hypophyseal axis into the inflammation cycle. That is the very valuable cycle that controls inflammation within the body. Remember now, the body has to have a mechanism to allow short-term inflammation, but arrest long-term destructive inflammation. Let's see if this does it. So now let's suppose that we go back and say, well, all right, I overexercise, that's an injury, and my joint hurts. My joint hurts. I'm stiff and sore all over. Well, if you had a weakened cortisone pulse, that would create an arthritic flare in you. But now, you're not an arthritic, so you created inflammation by overexercising. You had a lot of fun, but you got really stiff and sore on it. All right, now, if that had been an infection, and you had gotten a cut in the fall in the overexercise, then the body would allow that inflammation, allow the immune cells, and handle the infection. It has to have time to do that. Where did it get time? Well, these are all chemical mediators going from inflammation down to the cortisol pulse. You have to get from here down to there, and so that gives it a time delay that allows short-term beneficial inflammation and quenches long-term destructive inflammation. We have a beautiful system within the body. Now, And when it's broken, when it has a defect, when the cortisol pulse is weakened, then it doesn't work and inflammation lasts too long.